Hi, it's Dr. Noel Williams, Optimal Health Associates, August 27, 2021. Happy Friday, everyone. It's the weekend. I hope most of you will be able to relax, if not all of you. I'm going to do my best. So, COVID update, other stuff. So first and foremost, it's really clear that it's between COVID, the disaster that is Afghanistan, the lack of any semblance of current stability across many things, that people are stressed. And I'm stressed, Kim's stressed, people are stressed everywhere. But one of the things we're noticing, and some of my doctor friends are noticing, is that when people come in or call, they're stressed. And we're very, very empathetic. I'm very empathetic to people being stressed. However, what I'm not empathetic to is yelling at my staff. And I'm hearing this from every doctor that I know and provider I know and the ER doctors. People are stressed, and because they're stressed, they're yelling at people and being mean. Being mean to people who answer phones is not appropriate. Being mean to medical assistants, RNs. If you're going to be mean to someone, be mean to the doctor or the provider. But again, I wouldn't be mean to any of the providers either, since they're taking care. At least if you're in my practice, if you're mean to me, I can handle it, and usually I'll be able to make you feel better, or it won't bother me that much because I'm a forgiving person. But please remember, these are just people working for you. Yelling at them is how you get terminated from my practice. We terminate people for being mean to staff. I have no issue with doing that. It causes me no stress. If you're mean to my staff, I am going to terminate you. It's that simple. If you're mean to me, I'll be saying sorry and saying, I'm sorry we screwed up. Be nice. We're nice, be nice to the other doctors. I'm giving this editorial at the request of my manager because so many people are mean to our staff on the phone. Enough of that. But it's everywhere. Everyone's stressed. You notice it when they're driving. But don't be mean. Being mean makes you an ass. Stop it. Anyway, enough of that. So the COVID update. So again, Delta's here. We had about 35 or 40 new patients this week with Delta who were just within the practice. Again, we do not treat people from outside the practice. A bunch of the people from last week, several of which were prior vaccinated and infected, who I've talked about, they got fairly sick in terms of nothing with really significantly with their lungs, but they felt terrible. I mean, one of my main people, who shall remain nameless, she had an awful 5 or 6 days. So this Delta thing is not easy if you get it, even if you're vaccinated sometimes. So again, take your vitamins, take your zinc, do at least 25 milligrams a day. If you haven't been on any, do 50 a day with food, because it can make your stomach upset for at least a few weeks, and then you can cut back to 50 every other day. If you're not on vitamin, take your vitamin D. There's more and more data on the blood clotting, the arterial stuff with COVID. One of my good friends had a patient who had a clot from just below his heart and his aorta all the way down to his pelvis. Needless to say, he did not survive. This is a disaster for that family and those people. He was unvaccinated. Be on fish oil, be on vitamin D, be on your zinc, be on a multivitamin, get your vaccine. That's what you need to do. There was a bunch of younger people in their 20s died this week, and Kim said there was the teenager in the ICU may have, I guess, passed away this week. Again, someone with a lot of complex morbidities, but it's still a very, very tragic and sad thing. So think about getting the vaccine. We strongly encourage everyone to get the vaccine. So that's what I can tell you. Updates. Not a lot. Delta's here. It's going to stay here for another few weeks to a month and a half. I hope that will be all. Number 2, Lambda will slowly make its way here. So if you don't get Delta, you haven't been vaccinated, and you haven't had a prior one, you are going to probably get Lambda because the virus is getting to everyone eventually. One question we've gotten, is a BAM infusion or a vitamin or a antibody infusion useful in those that are vaccinated? The answer is yes. If you're having an escalation in your illness and you have risk factors. So we've had 2 of those people so far, both of which got the vaccine, and it seemed to help them very quickly. One was an older person with Parkinson's, and one was a person with an established immune defect. Both of them had been vaccinated, both of them got Delta, both of them had escalation in their illness, and we referred them immediately for BAM infusions. So that's a relatively simple process, sort of, not really. But the process of getting the infusion of the antibodies is relatively simple. It's just the paperwork and making sure you meet the criteria is a little involved. Big shout out again to the healthcare providers, the ER nurses, the doctors, the respiratory techs, the clerical staff in all these hospitals and ERs. There's basically no ICU beds in Oklahoma City. Big thank you to Carl Roskowski for saving someone's life this week, a COVID patient who was bleeding out. Way to go, Carl. You're amazing. You're fantastic. A big shout out to David Chansom, who's working all hours of the day and night for people, along with all the pulmonologists. But they're the 2 I know the best who are doing this, and so they're just a tip of the what is it? Iceberg. Thank you. At 57, the metaphors or analogies go away. You kind of remember them, but you don't. You'll just wait. You'll enjoy this age. So this is in no way dismissing, I mean, the myriad of people like Aaron Boyd, who's running critical care in Norman, or all the other people who are just kicking butt and taking names and saving patients' lives everywhere. So thank you to all of them. Thank you to all the doctors everywhere working and their staff. So be nice to them. Be nice to your primary care provider who's trying to help you. Be nice to their nurse. Be nice to their front office person. Yelling at people who are just at the front office is a terrible thing. You are a terrible person if you're doing that. I want you to understand that. They're not there for you to yell at them if you're frustrated. Yell at the doctor. I always say, yell at us. We have broad shoulders. Don't yell at the people who are just there trying to get you in. It has been a very terrible problem this last week. I understand people are stressed, but you have to stop doing it. So anyway, thank you very much. Anything else, Kim? And all of that was based on the fact that my staff is feeling it. They're super nice, sweet women, and Z, the other guy in the office besides me, excluding Dr. Smith's staff. So anyway.
And Dr. Berenberg.
And Dr. Berenberg too, but he's a guy, so hey, you can yell at him too. He can take it. Anyway, so we just want everyone to try to be nice. We're nice, so be nice. Anyway, thanks. Sorry if I rambled. Bye.